Hi everybody, this is Dr. Matt. This is a little health tidbit I want to throw out there, and today we're going to be talking about peptides. Peptides are a group of amino acids constructed in a certain way to elicit a communication response in your body. These are naturally occurring things that happen in your body. And what's neat about these peptides that are out on the market is that they work with your body to elicit a beautiful response. So today we're going to be talking about growth hormone releasing protein 2. So that's growth hormone releasing protein 2, GHRP2. And this wonderful substance can be used for a variety of different things. Anything from helping you recover from debilitating diseases, weight loss, bone mass loss and osteoporosis. It can help with tendinous recovery from injuries, ligamentous recovery from injuries. And the neat thing about this peptide is that it helps your body to release growth hormone, yours. Not an outside source that we know can come from who knows where, it constructed in some lab and we don't really know what it does, but it's yours. So your body is used to it. It's used to monitoring this, it's used to working with this, and the communication process with your cells are therefore what I call clean. There isn't a mix-up. There isn't something that your body is going, wow, this is too much, but it's there, and your cells just continually use it. So there's an up-regulation system and a down-regulation system here with this one, which is much better than I think with outside sources. This peptide is, well, there are many peptides, but this peptide in particular is really wonderful because I love to use it with rehabilitation on different levels for things. So I'll use it with a patient who has an orthopedic problem, knee problem, shoulder problem, spinal problem. I'll use it for cancer patients who need to gain weight or gain muscle mass or help them to eat. That's another wonderful side effect of this growth hormone releasing protein 2, is it helps you release something called ghrelin. And that is an appetite stimulator. And so for those of you who really have a problem with an appetite, a true appetite, this will help. It will help you to have a hunger, and it will help you to utilize those nutrients very, very rapidly. But we're going to stop there for a minute. We're going to talk about nutrients because this is important. Your body was designed to use nutrients to help fix and maintain your body. So diet is key. Getting those right amount of vitamins, minerals, and essential nutrients, fatty acids, etc., are so important for you to understand. So if you're eating at McDonald's, if you're eating fast food all the time, you're getting processed food, 9 times out of 10, you are not getting enough nutrients. You're not getting real nutrients, or what I call live food. And that is important with all my patients. Any patients that come to me, I don't care what the problem is. I don't treat symptoms. I treat the cause. 9 times out of 10, the cause is they are so nutrient depleted that their body couldn't heal from anything if it wanted to. And then we're going to talk about why the body gets depleted so rapidly in this day and age. Well, there's many reasons. Stress, traumas, oh gosh, we can go to environmental toxins, we can go to poor sleep habits, crazy work schedules. I mean, there's many, many things. And I understand all of those things. I mean, I ran a crazy busy practice. I run crazy busy businesses now. And one thing I do is I make sure that I take care of myself. I learned that lesson. I was one of those doctors that was very successful early on in my career. I was blessed, but I was crazy busy. I mean, I think we did my last year in clinical practice, before the Blue Room came into my life, I did over $600,000 in just business for myself. And that's not anything to say, whoa, Dr. Matt. No, it's just to tell you how many patients I saw. It was a lot. And I was drinking energy drinks, not eating correctly, and my body started to deteriorate. And it deteriorated very, very rapidly. And the way that I went to fix it was not only through peptides, but it was through good, sound nutrition. And I like to juice. So I put out a little thing on Facebook today about what I juice. I like to juice apples, carrot, celery, turmeric, ginger, and I'll add some other things in there depending on the nutrient content that I want, and also to help my body detoxify. But turmeric is such a wonderful anti-inflammatory for the whole body. For nervous system tissue, joints, for gut, it's a wonderful thing to do. So that's a little tidbit right there. And for those of you that are scientific, this is really important. You need to listen. You can't create matter from nothing. You have to have the building blocks. And if you look into chemistry, that's just the elements. And you get the elements from your food. Now in physics, we know it's energy. And the energy comes from our food. Now, frequency is everything. We know that. You've heard me talk about the Blue Room. And all of this that I'm giving you, this information, is going to add to your healing process with the Blue Room. It just adds to it. So if you are doing your best to mentally focus, you're doing your best to eat good foods, get enough nutrients, to sleep, to focus, to meditate, to clear out the old and the past in your life, and you start using that Blue Room, I guarantee you're going to find healing. When you come to see me in my clinic, I talk to you for the first 2 days about lifestyle, decreasing the old. Get out of the old, get out of your way. Don't allow things that were in your past to enter into the future now. It's going to do you no good. And obviously it hasn't if you're sick. So having the guts to do that is an important part. But having the guts to eat correctly also is an important part. Drink plenty of water, get your sleep, get out of the stress, get out of the old, okay? So there's my little tidbit for that. Now we're going to get back to the peptides. There are quite a few peptides that I use in treating patients and have for a number of years. Growth hormone releasing protein 2 is just one of them. There's also something called TB500, body protectant compound 157, HCG for men and women, that's human chorionic gonadotrophin hormone. That's a mouthful. Those things, they have specific purposes, and I use them to treat different things. But you're not going to find the medical community is going to talk to you about these things, and that's why I'm making this video. I want this out there for the people. I want this out there. And peptides are not produced by pharmaceutical companies because they occur naturally in your body, and therefore they can't patent it, so they're not going to make money on it. So there's companies out there that do this. They're going to tell you that it's not legal, but it's not illegal. They're going to tell you they're not for human consumption. And all of this is going to be written on these bottles and the information. I'm going to tell you this. It's one reason why I moved to Latin America, where my home is because you have the freedom to make choices for yourself. And I know in the United States it's coming, but right now it is a difficult thing, and most doctors don't have the information to give you about these things. So here we go. I'm going to give you some. So we're talking about growth hormone releasing protein 2 today. This is a great thing to add if you're recovering from injury, if you are trying to gain some weight, muscle mass, if you're trying to heal from bone or spinal injury. And it's also great if you're just trying to overall build your body back up from a state of depletion. It is really wonderful. Now, I'm going to go back into foods. You've got to put those good foods in there. You have to, okay? Next, we're going to be talking about body protectant compound 157, and then we're going to go into TB500, and eventually we're going to get into HCG, which is human chorionic gonadotrophin hormone. And these are all peptides. These are all available all over. You can Google these things. You can look them up. But I wanted to get this out, and I wanted to be able to get people thinking outside of the medical box. I want them to understand there's a lot more out there than what's in a prescription for health, and it's important to me. Now we're going to go back to the Blue Room for a moment. The Blue Room is frequency medicine. That's what it is, and all of us who understand life know that frequency is everything. So I'm gonna put this out there. If you are in a frequency of negative, you are in the frequency of a victim, you are in a frequency of stress, you are in the frequency of hate, you are in the frequency of want, but not the good one, the greed, you're going to attract that into your life. And remember, you are the common denominator in your life. Nobody else is. We like to blame. We like to say, this person did this to me, I'm here because of this, this, or this. You can go along with that as long as you want. But remember, your body hears everything. It hears your mind. So in here, in your deep subconscious and your frontal lobe, your conscious state, if you are constantly a victim, you're constantly blaming, you're constantly look to tear people down, 9 times out of 10, you're going to have a very miserable life. Now, what does this have to do with the Blue Room? Everything. Go. If you're finding depression in your life, you're finding hurt in your life, you're finding PTSD in your life, go to the Blue Room. Get a treatment. Build your nutrition up. Get some rest. Change your life. And it is okay to tell people that they're no longer welcome in your life. Not with hate, not with malice, but with love. If you find that people are no longer helping you, adding value, as I spoke about before, to your life. Not that you dislike them. It's just, what's the point? And it's all about that frequency. You want to be in that healing frequency all the time, all of your life. You're going to find joy. You're going to find it attracts the right people. You're going to find your children are just happy because you set that precedent in your home. The adults set the precedent in your home. And you want your children to be in that. I love you all. Remember those peptides. If you have questions, email me, get on Facebook. Let's talk about it. I'd love to help you all out. Growth hormone releasing protein 2. It can really help you heal from a lot of different things. This is Dr. Matt. I'll talk to you again soon. Bye-bye.